Hello everyone, this is case study number 4 for our epidemiology spring 2013. We are here to discuss an investigation on CA-MRSA, that is community acquired methicillin resistant Staphylococcus aureus outbreak. So what is the case? So apparently a high school athlete director called to notify the department of a parent complaint regarding her child as a suspected case of CA-MRSA. The boy has a painful swelling on the anterior aspect of his left leg where he had been healing from a previous abrasion. The symptoms: he was running a high fever and has developed shortness of breath over the weekend. He was evaluated by an emergency room physician at a local ER where cultures of the skin infection have suggested that the organism is Staph aureus. So what is the issue? The athletic director is concerned that the boy contracted this disease at school or during the practice in school, and the mother has already law it up, and we need to get to the bottom of this situation as soon as possible. So our role: we are the investigation team who we serve as assistants to the state epidemiologist, and who unfortunately is since currently out of town. So pretty much it's just us. Let's get started. So what is CA-MRSA? Well, it is one of the most common etiological agents of community-acquired skin and soft tissue infections. The most common at-risk population includes prisoners, athletes, military recruits, children, sometimes pregnant women too. Typical symptoms include forming pustules which become then red, swollen and painful. So how do we diagnose this disease? The first step in lab investigation is to confirm the diagnosis of CA-MRSA and is to send clinical samples for microbiological testing. The sample may include a specimen of pus or a swab from lesion obtained from the site of an infection or sputa from the suspected patient. Samples are typically cultured on non-selective media, that is blood agar, for the growth and recovery of potential pathogens including Staph aureus. Outbreak. So what is an outbreak? Outbreak is defined as an increase in the number of cases of disease over and above the expected number of cases. CDC to the rescue. There are 10 steps by the CDC. It is a scientific approach by which we will institute the preventive measures as well as take control of this disease. It will also help us formulate a few policies, public relations, and do a few research and training about this disease itself. Who is a part of? So should we do it? Let's have a look. Okay, so now who becomes a part of this team? There are various members who are a part of this team. Firstly, an epidemiologist. An epidemiologist will be the leader of this investigative team. He or she will collect the data from the emergency room of the hospital where the case is admitted. A physician. A local physician who is involved with the community, has a well-known idea of all these cases, will be in charge of all the necessary lab work to be ordered and to confirm the diagnosis. The nurse will also be appointed. The nurse will collect the samples and send them to the laboratory, as well as these samples will be collected from the blood, wound cultures, pus from the skin lesions, nose and throat swabs will also be taken. An environmental health expert will examine the school premises, and samples will be taken from the schools, which include the classrooms, the athletic locker rooms, etc. Data collectors are also important. They will be appointed and trained for this outbreak investigation. Lab technicians and microbiologists will conduct the necessary required lab tests of the specimen. All the reports will be notified back to the physician and the principal investigator. Local contacts. Any personnel at the school will be considered as a local contact. The team of the hospital will then meet with the CDC team. Interview will be conducted at the school. After that, the sample will be taken from the skin lesions, nose, throat, and all this will be collected, and then a further analysis of this case will be done.
So now we heard why we are conducting the outbreak investigation. To find out the cause, we conducted a case control study to see if the boy caught the infection from the school. So our hypothesis became being a student at the high school X and playing sports is not associated with the risk of developing CA-MRSA infection. Our case control study showed no significant causal relationship between being a student at the given high school, playing sports, and development of CA-MRSA infection. So now to find out the cause, we focused our attention to the other sources, and it came to our attention that a nurse at a community hospital is probably the cause of CA-MRSA infection. Now again, to find out the if really the nurse was the source of infection, we conducted a case control study, and we found out that yes, indeed the nurse was the source of infection. And now yes, the case is resolved.
Phew, so the mystery is solved, but the problem is not solved yet, and we must do something in order to prevent this spread. So what are we going to do? So after finding the source of infection, we notified school officials and the clinic from where everything got started, and we also notified the local health department to address this issue. But we want to recommend infection control measures if the boy had acquired this infection at school. This involves personal hygiene measures, which includes proper hand washing, maintaining adequate hand hygiene when you are at school, and when you are sharing equipments in the sports room and other areas in the school. It also involves taking proper wound care and listening to your doctor when you are infected. This also involves environmental sanitation measures from the school officials, which are a must when you are at a school, and schools must address them.
It is important to incorporate health education and policy. In terms of policy, all patients with a confirmed diagnosis of CA-MRSA should be isolated to prevent the spread of infection. Special preventative and treatment-related care should be mandated for all children under the age of 2 years of age and suspected to have CA-MRSA. All healthcare workers should be routinely screened for MRSA. For education, it is important to raise awareness of CA-MRSA in order to increase prevention efforts. Create web-based resources that include educational links, make recommendations for all clinics to use contact isolation procedures, and distribute posters and flyers with quick facts to the general public. So in conclusion, stay clean, wash your hands, stay away from CA-MRSA. Thank you.